My research has been focusing mostly on lifestyle interventions and also knowledge translation. As a psychiatrist, we are always trying to make the best assessment, to come up with a plan for a patient. We now have really good treatments, medication, psychotherapy, evidence-based psychotherapy. We have technological resources like RTMS, deep brain stimulation. They are quite effective treatments. We've been fortunate to have funding from OBI, Brain Canada, for example, to support a number of different studies. However, a lot of patients, they do not respond to traditional treatments, or they are not interested in taking the medication or eventually even doing therapy. And people are more and more interested in learning about new types of treatments. And lifestyle medicine has been something that is being quite highlighted right now. Dr. John mentioned we have a lot of issues related to cardiovascular health and brain health. So we know that it's integrated. And a lot of studies have shown that people with depression, they show a pattern of accelerated aging, right? So the same findings we have in the brain as we age, we can find in younger people with depression. So there's a parallel of how depression acts in the brain and how the normal aging process. And we're thinking how we can do to actually prevent or eventually reverse those processes, right? Diet and exercise are main interventions that we can do. Physical activity increases the cardiovascular health, the cardiovascular tonus, the brain oxygenation, and this is well known to improve depression and also to prevent a lot of this aging that we see prematurely in patients with depression. We know that the Western diet, unfortunately, most of us would adhere to the Western diet with a lot of highly processed foods, sugary drinks, not a lot of vegetables or fresh fruit, for example. It's associated with worse outcomes, both related to depression, anxiety, across the lifespan. So those are at least two of these lifestyle factors that we are investigating as new approaches to treatment of depression, but we're confident that this will also lead to better brain health in everyone.